Hi, I'm Rachel Wall, founder of InspiredHygiene.com, and I told you earlier in the year that we were going to give you some book recommendations. So this is the first one, and this is a book I actually read a couple years ago, but I've been reminded of it again. It's called Unmarketing by Scott Stratten, Stratten. So it's about social media and marketing, and we're thinking, well, how does that apply to hygiene and kind of what we do? Well, one of the quotes that I heard Scott say on a recent interview was, if you believe that relationships help build your business, then make your business about building relationships. And I mean, we do that, right, in a dental office all the time. That's such an important part of what we do. In fact, sometimes those relationships hold us back from recommending the best care. So I want to talk just a couple quick tips about how hygienists within the practice can really help build those relationships. We're really good at that. You know, one of the first things that comes to mind is making those personal notes, knowing personal things about patients, and then, you know, asking them about it when they come in. We're really good at that, right? Sometimes we spend a little too much time on that piece. But there's some other really great relationship building pieces, like calling patients, right, after they've had a procedure where maybe they need anesthetic. So calling them up personally and checking on them that evening. Giving them a specific reason to return for their next visit. So if you have done a periodontal maintenance procedure today, and maybe there's one area that was bleeding, and maybe you placed a side of local antibiotics there and did some localized therapy as part of the perio maintenance, you say, hey, next time you come back, we're going to really specifically look at this area, and then making a note and then doing it. You know, a lot of it is just following up on what you say you're going to do. Knowing their history when they sit down. So you've reviewed their history and you see they had a crown done a couple weeks ago or a couple months ago, and saying to them, hey, that crown's feeling good, right? And then all of a sudden they know, she knows about me. You know, I'm not just another patient that showed up in his or her chair today. Another thing that we can do to build relationships is customize the confirmation process. So when they say, you know, I'm here, I don't need all the extra reminders, then doing that and really honoring that. Honoring patients' time is a great way to build relationships. You know, if you hear that they have a new family member that's moved into town, you know, inviting them into the practice. Have them just come and check you out. Or if they've got friends from out of town visiting, say, hey, while they're here, if they need anything, please do not hesitate to give us a call, and then following up on that. So it's all those little things, and then it all comes down to that willingness to build on that relationship and that trust and really offer those patients the best care, the care that they deserve, and letting them make the decision to say yes or no. No pressure, but connecting the dots for them on how this treatment you're recommending is going to help make them healthier, and that's just a great way to build those relationships. So, great book about building relationships and social media in your practice.